had one affirmation that I was just repeating over and over and over again. It was, I am strong. And anytime I felt like I couldn't do this, I'd look at that and I'd just say it over and over and over and over again. And honestly, it helped me get through it.
All right. Welcome back to the podcast. And this week's reviewer of the week is Canadian Dr. Mom. She says, thank you for the great knowledge and support. I am a family MD/OB in Canada and currently pregnant with my third. Though my knowledge base from my work is obviously more than a lot of people, the personal experience is always so different. And I do not think there could be any truer words than that. I experience it literally with everything that I do in my life. So I'm glad that you said that and I'm grateful you're here. She says, my 2 babies to date have been born without complications and with the help of hypnobirthing. I medicated. I think she means meditated. I've read this twice. I'm pretty sure she meant meditated. And I love that there is a place that I can listen to positive birth stories and direct my patients. That's kind of funny. I feel like that's okay. If they're feeling anxious or overwhelmed or not heard, I love listening and appreciate how you give evidence-based, non-biased opinions. I've already used some of your suggestions for the exercises, essential oils, etc. Now to work on having my husband listen along as well. Yes, if you guys are listening here and your husband or your birth partner has not jumped in and taken a listen with you, we have actually started compiling a list of the best podcasts that dads can listen to. So you can, I'm going to actually link to that below. Sorry, Danielle, for you that is listening right now. Danielle is going to link it for you guys in the show notes so that you can just click to it and see a list of our favorite episodes for dads. And that way you can click on a couple, see what you think, and then get dad listening. So whatever's going to resonate with you and feel good for your birth partner, you know them best, get them involved. Because as soon as you do that, then your communication and stuff about the entire process is just going to be so much better. So, all right, let's take a listen, you guys. It is another birth story podcast, everyone's favorite. Luisa is with me here today. Luisa, will you take a moment and introduce yourself? Tell us a little about you, please.
Yeah. I live in Utah, Eagle Mountain, with my husband and our baby. We have 2 cats and 3 chickens. We love animals and I want a dog, but the husband says no. So
keep working on that. My husband swore off dogs like forever and we have one now. So you can do it.
Yes, I'm working on it. And what else? Yeah, I mean, I've lived in Utah most of my life, but I was born in Colombia. But yeah, that's me.
Awesome. I love it. So Colombia, is that a little warmer than where you're at right now?
Yeah, it's a lot warmer.
Has it been a hard transition for you?
Well, I lived here most of my life. So I moved here when I was like 5. Yeah.
Okay. Fair enough. Yeah. With us, we just talked before we jumped on the podcast here, but with us coming from Southern California and then moving out of state for a nice long time, we were in Utah for like 9 years. But by the end, we were just like, please no more winter, please. So
yes, I'm so sick of it too.
Yeah. Come join us in Florida. We're happy to take you around and enjoy time together. That would be amazing. Okay. Do you want to tell us a little bit about this pregnancy? Do you want to give us any like past information? I know that your last pregnancy was kind of rough, and this is one of those, like, if this is not a comfortable place, you just let me know. But if you're able to do that for people that are listening, kind of like your past experience and then on to what this pregnancy was like.
Yeah. So I was pregnant right before having Archer and getting pregnant with him, with a little girl. We named her Genevieve. I went into labor early because I had have an incompetent cervix, which I had no idea that I had. But
for those who are listening, will you explain what that is?
Yeah. So that's when your cervix, like you go, you get pregnant, normal, everything's normal, but then your cervix will start to dilate early because it's just not strong enough to stay stay like fully closed the whole time. So anytime after usually after like 20 weeks, it can start to dilate and then you can end up going into labor early. So, they say they really don't know what causes it and you have no idea that you have it until, you go into labor. So, that's basically what happened with me. I went into labor at about 26 weeks and, I lost my baby, and that was really, really hard. That was hard for us. Um, but we ended up getting pregnant shortly again after, and we were able to, go to the doctor and get it's called a stitch on your cervix. Forget the exact term, but anyway, they stitched me at around 13 weeks, and I was anxious the whole time, like the whole birth, labor. Oh my gosh, pregnancy. I was anxious. I was scared. I was nervous about what I would do or wouldn't do. Um, but it went really well. I mean, the pregnancy, besides my anxiety, um, was healthy, and I was able to end up having my birth at home, and that was really awesome.
Yeah, that's great. I was going to ask you about, the like mental prep that you like. How did you work through that with becoming pregnant again, knowing that this could be an issue, like working through those fears? What did you do that really helped you?
Honestly, I prayed a lot. I didn't know what else to turn to. I had so much fear that I was going to lose this baby too, and the only thing I knew to turn to was prayer. And even then, I was scared. So um, I turned to that, and then I tried really hard to have happy thoughts, but those were hard to come by when you're like scared of losing another baby. But eventually, I think that prayer, and then of course like doing that surgery and passing the 26 weeks, I was like, okay, I know if my baby's born now, my chances of him surviving have gone up so much. And if I can just make it to 30 weeks. And then I was like, if I can make it to 32 weeks, and so on. And so,
That's
yeah.
awesome. Yeah, I'm sure it would have helped once you hit those milestones where you're like, okay, baby's good, even if. That's awesome.
Yeah.
So this pregnancy, other than having to have the stitch, which I'm sure is not comfortable for you to have to do, were there any other things that kind of like popped up for you or stand out to you? Any issues you had with your providers or testing or anything like that during your pregnancy?
The biggest issue with my providers was my doctor, my OBGYN. She was awesome. She was the one who was there for us when I lost Genevieve. But as I started getting closer to birth, or to like birthing a baby or labor, I wanted to make sure that the doctor I saw wasn't the one who I saw the night of the emergency room, who I guess I didn't see because I felt like he just kind of dismissed me. And he was one of the OBGYNs there that would deliver. And so I asked her about that. I was like, well, is there like a possibility that it's going to be someone else? And she's like, well, yeah, it could be anyone else if I'm not here, unless you schedule an induction. And I was like, I don't want to do that. And she kind of just was like, well, you either do that or you're just gonna have to have whoever's here, you know? And that to me, I just felt like it was like I get it's not maybe like a huge deal to them. And it's not like it was that doctor specifically, but I just like kind of had trauma with that. And I just didn't trust him because like when I went into the hospital the first time, he didn't even come and check my cervix. He didn't check anything. All they did was listen to the heartbeat and say, your baby's okay. And so I just didn't trust him, and I didn't want him to be the one to help deliver my baby. So that was my biggest issue. And then, of course, when I talked to her about possibly having a home birth, she kind of freaked out. It was actually really interesting because I had been talking to my midwife, and she had given me like all these podcasts and all these different statistics, and to like help me reassure me to know like how beneficial having a home birth actually is. And I'm not trying to like throw my doctor under the bus or anything, but the minute I told her, she flat out said, I don't actually know the statistics of how home births go, but I do know that I always see the bad cases, and more than not, they're actually bad, which I knew that not to be true because of the podcast I was listening to that stated like the things that were actually opposite. So it made me feel like, well, I think you're just, I almost felt like she's just trying to scare me into having a home birth. And then, I mean, having a hospital birth. And then she also was like, well, and I know you lost your first baby. And so this can make it dangerous for the second one. And I just felt like, well, it really has like, it doesn't, having like a home birth has nothing to do with like my cervix like being, you know what I mean, because like it has a stage. If you take it out after like 37 weeks, I should, and I like don't go into labor before there's no other complications, so I don't know why that would have anything to do with it, you know.
So those were kind of some red flags that sounds like that popped up for you.
Yeah.
Yeah. I feel like in case nobody has validated this for you, like just as we're sitting here, it's totally valid to feel the way that you felt about that particular provider and to not want to work with them. It doesn't make you a bad person. It doesn't make him a bad provider. It just means you're not a good match. And that was totally okay. I feel like even you're just like a very sweet, kind person. I can hear that about you, but like, I don't want you to ever feel bad for saying like, yes, I had trauma here and that's not going to work for me. And it sounds like you actually like kind of went through with and figured that part out for yourself. But I just wanted to take a moment and make sure that you know that it's like okay to have those feelings. And so it sounds like you were in a group practice with a couple different OBs. Now, when you're talking midwife that you were speaking with, this is an out of hospital. This is the birth center midwife that you were talking to?
Yeah. So
okay.
She doesn't actually have a birth center. She's just a midwife. Like she has like her practice in her home and then she goes to home. But she's in Bluffdale, Utah. Her name's Amy with Peaceful Midwifery. They were just amazing. And I met them when I was around 32 weeks pregnant. And I had talked to several midwives. I had taken like the questions you guys have in your course and I had like asked them everything. And Amy just like resonated with me. She just felt so right. Like, you know, when you guys say like, listen to your instinct, like it's so true. It just felt right with her. So yeah.
Excellent. That's awesome. I'm happy to hear that. Okay. So it sounds like you were like meeting with the OBs and stuff. At what point did you decide I'd like to talk to a home birth midwife? And like, how many weeks were you when you did that?
Yeah. So I started looking into that around 30 weeks. I just was like, it was kind of a weird thought. I was like, oh, this is scary. I'm not like other women. I can't do that. Like, I don't know how they do it. Like, I'm not that person. Like, I'd have to wait till my next one and see how the first one goes. And then the more I thought about it, I was like, why can't I be that person? You know, it's like, why can't I also look into it? And so I was like, maybe I can just look into it and see like what my insurance covers. And so I started looking into it. And then the more I looked into it, I was like, maybe I can do that. Maybe I can like actually have, first I thought a birth center birth, but after talking to Amy, actually, she really like opened my eyes to doing the home birth. Like, I mean, I knew the difference because of your podcast and the course, but she really made me feel safe about it. And I was like, okay. And then I think I ended up like actually like going with her around 32 weeks. I still had to see my OBGYN because she has to be the one to remove the stitch. But I was seeing Amy as well.
That's awesome. So did your husband go with you to any of those appointments then?
No, actually he didn't at first. The first few I went by myself. And he was nervous about doing a home birth, but I sent him, he was always listening to your guys' podcast because I'd be like, listen to it.
Yay.
But I sent him a lot of podcasts that Amy sent me as well. And then he finally came with me. And like once he went, he's like, okay, I feel good about this. This will be good.
That's awesome. Yeah. Very cool. Okay. So at which week, it sounds like you were at 32, you got the stitch out, but you had been meeting pretty consistently with Amy already. No,
sorry. So I met with her at 32 weeks. I got the stitch out at 37 weeks or 36.
Oh, okay. Okay. Awesome. So that was like your last encounter with that provider and you had the rest of your care over with the home birth midwives. Okay. That is so cool. All right. I guess let's kind of move through kind of onto your birth partner, were there any like challenges as you guys were preparing? Well, maybe let me back up. Let's start with this. At what point did you jump into the birth course and start doing some prep for yourself?
So that was hard. The thing is, I did a lot of prep work when I was pregnant at first, and I didn't finish it. So when I got pregnant again, I didn't want to do prep work because I was scared of losing the baby again. So I actually waited until I was 26 weeks to be like, okay, let's do the prep work again. Because I was like,
I like
just
it.
don't want to get invested, and then I go through the same thing,
Yeah.
So I did. I waited again, but I kind of had already done it, so I kind of had an idea. But I waited till 26 weeks. I left a couple things out, like that I felt were maybe dangerous if you have a like incompetent cervix. Like I remember you guys do the squat. I was doing those a lot, like going down on what is it called, the baby squat. What is it called? But I did do a lot of the other ones. Like I did get a lot of pelvic pain, and Archer was constantly facing the wrong direction. So I was trying to get him to go in the right place. We did a lot of meditation. And we did a lot of practices, lots of labor rehearsals. We did tons of those. And I'm so glad we did, because once I did go into labor, I just felt like I knew a little bit better what to do,
Yeah, I think that's good. Was there anything else that you and your husband did together that was really helpful for you guys? So like the labor rehearsals, did you guys practice those together? Was that on your own, or what
No,
things like really helped you guys get
Yeah,
prepped?
we did them together. What honestly I feel like helped me was some of the exercises, because I had extreme pain in my back when I had Archer, because he was he wasn't facing the right way. So I had back labor.
Posterior?
Yes. So I had really bad back labor. And so when I was actually going through that, I was like, Justin, do this exercise. Like, it was the one where you push on the back. And we practiced that one a lot. And I'm telling you, that is the only thing I wanted done the whole time, because I was like, it helps so much, like counter the contractions that were coming in.
Counter pressure is like huge. And especially when you've got like, we're using heat and stuff on your lower back too.
I don't think they did put heat on me. I don't think so. But I should have. We went in the shower and then we had the bathtub. But it's just,
nice.
I just needed someone to push on my lower back the whole time, basically.
Yeah. Yeah, for real. Okay, so you listened to the podcast, you took the birth course, obviously, you did a ton of preparation with labor rehearsals. Was there anything on your day-to-day that you were really good about, or that was on your mind a lot, that helped you prepare as well?
Yeah, I went on walks every day, and I think that helped a lot.
So good.
And I made sure to get lots of water all the time, even though I was already peeing all the time. So it's like,
right.
And I tried to get a lot of protein in. So I think all those were really, really helpful.
Yeah, that's great. Okay, take us through the birth. Take me from that very first contraction all the way through.
Yeah, okay. So I woke up because, I don't know if this is too much, but I thought I was like peeing myself. And then I was like, oh no, I better go to the bathroom. But so I'd like go to the bathroom, and then I was like sitting on the toilet, but I was like, I don't know what just happened. I think my water just broke, because I was like, I didn't just pee, I just sat down. And so I was like, oh no. And so, I mean, I was excited, but I was also nervous. But I was also kind of unsure at this point, because I had no contractions yet. My water had broken, but I felt nothing. And I was also confused about it, because I thought, oh my gosh, do I have to go straight to the hospital? Because that's what my OB/GYN had originally said. And I thought maybe it was dangerous or something. So I called up my doula, who was awesome, and said I can call her anytime. So she's like, no, just like relax, just text me, pay attention to your contractions, see if you can fall asleep. So I did. I went back to bed. I did fall asleep for a bit, but I did start feeling contractions shortly after. They were really light, and they were really spread apart. So then my husband, I think when he woke up later in the day, I think we got up around like 6 or 7. I was able to sleep, but kind of not like I woke up and slept, and you know what I mean. And we I actually had an appointment that day with my midwife, so we just went as normal, and she gave me like a tunic. I don't know, something that like is supposed to, if you're having
Tincture?
a tincture, if you're having contractions, it's supposed to like help make them come like stronger and better.
Mm-hmm.
And so she's like, take them every 15 minutes. And I started taking it. And by the time we left, we had gone to Smith's. And by the time we left, I was like, they were getting pretty intense. And so we went to Smith's, and then we went home, and I had lunch. And after lunch, I was like, I think I gotta go lay down. Like I'm starting to feel them, like they're starting to kind of feel enough where I have to just kind of be somewhere, like just relax. so so I went and just laid down, and then after a while, we called my doula, and she's like, okay, call me once they're like every like 10 minutes apart. I'll head over. And I felt like they were progressing fairly quickly. I don't know if it was that tincture that was just like helping them, but yeah, I continued to take them. And once she got there, my doula, she had me get in the shower to help with the pain that I might have been feeling. And she actually said, like, they were listening to the sounds I was making, and she's like, oh, it sounds like you're getting like closer to, I'm sorry, it's been a while, so I'm forgetting a lot of the
No, you're good.
more to like forgetting the faces, but anyway, it sounds like it's progressing more. And so she called my midwife, and she had her listen over the phone, and my midwife was like, oh yeah, it sounds like it's progressing. And she like came over, and they put me in the bath, and I mean, it was just getting more and more intense for me. And she's like, it sounds like you might be like, after a few hours, I don't even know how long had gone by, but she goes, it sounds like you might be ready to push. And I felt ready to push. And so we kept trying and trying. And finally she checked me, and she's like, oh my gosh, you're not ready to push. Like, you're at a 6. And that to me, just like, I was like, oh, but it was
That's so hard to hear.
Yeah. But it was really weird because I felt ready to push. Like, I was feeling it. And it turns out I had a cervical lip. So it was kind of getting in the way of Archer being able to, like, all of my cervix being able to dilate. And so I was like, I think my body at one point just shut off. Like, I had no contractions. And I think I was there just laying there for like 45 minutes, like finally, like, oh my gosh, there's nothing coming. I'm relaxed. And they finally were like, okay, let's give you some yogurt. We got to pick these up again. So once they started kind of getting me to eat something, they started to pick up again. And my cervical lip just wasn't like going down. So Amy she grabbed ice, and she put it there to kind of push down the swelling. And then she'd have me try to push through it. And that was just like, I don't know, that was intense.
Not your favorite part.
Yeah. So eventually they had to take me out of the water because I had been there for too long. They're like, okay, this isn't helping. Let's take a break. And so I went over to I was trying to get over to the side of the bed, and they wanted me to go up and down my stairs to see if maybe Archer would move just a little bit, because his head, if it was moved just a little bit, it could break that through that cervical lip. But I just couldn't move. And I was like, just give me a second. And I started I was bending over my bed, and I'd sway back and forth because it's just what felt good. And then I'd bend down, and then I'd stand, and then I'd bend down and I'd stand. It's just what felt right. And I should say, mentally this whole time, once I was getting to this point, I was just kind of done. I was like, I don't think I can do this anymore. And am I going to have to get an ambulance, or am I going to have to go to the hospital? And if I do, am I going to have to get a C-section? And I was like, I was just like, I'm done. I can't do this. I was so scared. But after a moment, I felt something. And I should say, I literally had not bled this whole time. Like, how there's like lots of blood, or I had no blood. And anyway, I felt something kind of like shift, and I just started feeling something coming through. And then Amy's like, oh my gosh, something's happening. Like she could see, like she said something in my back, but she could see something in my back. I don't know what it was, but she could see some type of movement. And he finally started to come. So I guess like that movement of like standing and squatting really helped him kind of be able to shift enough to push through. And I guess I probably should have talked about like how so I had affirmations all throughout my bedroom and my bathroom, and I remember you guys talked about the 3 R's.
Yes.
So that helped me a lot because I had one affirmation that I was just repeating over and over and over again. It was, I am strong. And anytime I felt like I couldn't do this, I'd look at that and I'd just say it over and over and over and over again. And honestly, it helped me get through it. Like, I mean, that was the one that helped, like, resonated with me for what I needed. But yeah, then Archer, he came and he just his head popped through. And then I just felt like as soon as his head popped through, I knew the next push he'd come out. And he did. He's just like, just flew right out. And I was so grateful for Amy and Catherine just being so patient and not making me feel scared. I mean, I was scaring myself, but they were so patient. They didn't ever be like, they were never like, okay, we have to go to the hospital, or, they knew what to do. They knew exactly how to handle it. And my doula and my husband, they were just awesome.
Yeah. As you were talking, there were like a couple of things that were going through my mind where this would have turned out so different if you were in a hospital setting, Our bodies are really wise, and so I feel like oftentimes in a more medicalized setting, the recommendations and quote unquote help that is given isn't necessarily what our body is looking for at that time. Yes, it can do the same thing. But for example, when you were needing, like in the beginning, she gave you the tincture to like get contractions going because water had broken and whatever. Look at how well that worked. Your body was ready for labor. It's reacting to those things that are totally natural and good. Versus if you were to go to a hospital setting, they would have done the same thing, but they would have done it with Pitocin. And how our body reacts to that, how our mind reacts to all of it is just very different. Same thing with your body resting for 45 minutes. If you don't have contractions for 45 minutes in a hospital setting in the middle of labor, that's like a cause for panic, right?
Yeah.
But when you're at home, it was the same thing for me. I rested and woke up in transition. It was a 45-minute nap. I had 2 really strong contractions during that time, but only 2. And my midwife was like, take it. Like, you need the rest. Obviously, your body, like, listen to your body. It's the same thing. Or you being able to listen to yourself. Midwives are giving recommendations, and that's great. And you can take those, but you had the opportunity to listen to yourself as well. Trust that intuition. It just felt right to stand up and sit down and go, whatever you were doing. And just as your mind is telling you, I can't do this anymore, right? Like now you can probably look back and say, oh, dang, that was probably transition, you have this shift. And I think our bodies are so wise. And I love that out of hospital birth really honors that. We don't find that as much in hospital. It's not a slight to in hospital. I think it's just the like training and the environment and situation that's there. But that's the beauty of being able to listen to your body and trust your body, trust your baby, and have the people around you really supporting you and kind of carrying you through rather than making you question yourself or making you question what your body is doing. So it's a pretty powerful story. I absolutely love it. It's so good. How many, I don't think you mentioned how many weeks you were when your water broke during the night.
I was 39 weeks, actually. 39 weeks
Perfect.
in a few days, yeah.
And when it broke, was it like clear? You said you couldn't tell if you were peeing or not, so I assume it was just like clear water, yeah?
It was clear. And yeah, since I thought I was peeing, I was like, but I realized I had no control over it. And so I was like, oh, this is my water.
Yeah. Yeah, that's awesome. Do you remember how contractions felt for you when you first started feeling them, if you were to describe them to somebody?
Yeah, I think, how can I explain them?
And
Okay,
yours would be a little different, right? Because of that posterior baby.
yeah, they felt, I guess I feel like I could explain it more by like showing. It just felt like it was like my uterus, I guess, was just like tightening up, like,
And
everything kind of
squeezing
tight
together.
in, yeah, and then it kind of loosened. So like at first it really wasn't like super painful or anything. It was just tightening, almost like a more intense Braxton hit.
And then as it continued on and you started to feel it in your back, what was that like, if you could describe it?
Oh gosh, honestly, it felt really sharp in my back. It felt like someone was like pushing down my, like the back of my like in the middle, not the middle, but the bottom, like the lower half, and then in between my back. It felt like someone was trying to like break through.
It's intense. Yeah, with a baby in a funky position. When your baby came out, did he come out posterior, or
Yeah,
had he turned? He came out posterior.
posterior.
Oh my goodness, it's so much good stuff. I'm sure it's such a good memory for you. He paved the way, right? So those next babies, they'll just pop right through. How about your immediate postpartum or any of that? Was that pretty good for you? Like delivering the placenta, all of that kind of stuff?
Yeah, the placenta wasn't hard at all. My placenta was kind of funky because it had like an extra lobe to it.
Oh, nice.
Yeah, but yeah, it was fine. It came out fairly quickly. I mean, I think she had like a little pill or something that is like has some pitocin in it a little bit. And she did put that in to kind of make sure that that extra lobe was out, and stop any possible bleeding. But it was really quick, which was really interesting for me because compared to when I had Genevieve, it was extremely painful to deliver the placenta, even though it was small. It hurt really, really bad. And then my doctor had to go in and like scrape the rest of it out. But with
Oh,
this
wow.
part, yeah, this part, it just came out. And I don't remember if it was on your podcast or if it was Amy, but I remember wondering about that. And I remember either hearing somewhere that it's because like when you are ready for giving birth, your placenta is also ready to detach versus when you're not, it's like it's stuck in there. So they gotta like take it out
Right.
and force it out. So it obviously hurts then versus not. But I don't know, maybe it hurts for other people even when they're ready. I'm not sure.
Yeah. Yeah, that is interesting. And maybe just the management of it. I don't know how Amy managed it, but I would imagine that at home it was probably she gave it a little bit of time and some gentle tugs,
Yeah.
versus somebody pushing down on your uterus and pulling fairly hard on the cord,
Yeah.
like you see in a hospital setting.
Mm-hmm.
Yeah. Okay. Before we leave, and thank you so much for your time. This has been really great. But do you have any advice that you'd like to give to moms and advice that you'd have for dads before we jump off?
Yeah. Honestly, I love the advice you guys have given in the past of trusting your instincts. Honestly, I feel like you don't really know until you know, but if you just like trust your instincts, your body really does know what you need and you know what's best for you. And maybe that is a home birth or maybe that's not a home birth, but whatever it is, it's going to be what is right for you and your baby. And and you should go with whatever your instincts tell you to. And then for dads, I think it's so important that that they listen to the podcast and they do the exercises because when it comes to giving birth, your spouse really needs you there. And if you both are doing all that practice, you're so much better prepared and you don't feel as scared when you go into it. And it just helps a ton.
I love it. Great advice and great story. Thank you, Luisa, for being here today. I appreciate it.
Yeah, thank you so much, Stephanie.